Let's get straight to the point. Point number 8, the trepanation drill. Picture this. You're in ancient Peru with a splitting headache. You're thinking maybe some rest, maybe some herbal tea. But no, your friendly neighborhood surgeon has other plans. He's eyeing your skull like it's a coconut that needs opening. The trepanation drill is basically a hand-crank carpenter's drill, except instead of installing shelves, it's installing a skylight directly into your brain, and you're awake for the whole thing. Conscious. Probably tied down because most people don't sit still while someone manually drills through their skull. Here's the twist. It actually worked sometimes. Ancient Incans achieved a 90% survival rate, which sounds impressive until you remember 1 in 10 people still had their brain exposed to mountain air and died anyway. Evolution forgot to install pressure release valves in our skulls, so ancient surgeons just power tooled their own. Every time you pop an Advil for a headache, just remember, you could have been born in an era where the cure involved carpentry. Point number 7, the arrow spoon. Imagine you're a Roman soldier and someone shot you with an arrow. Rude, right? But don't forget the 2-foot shaft sticking out of your chest. You're hoping for a miracle. Instead, you get a field surgeon with what looks like a medieval ice cream scoop welded to scissors. Before this innovation, arrow removal was simple. Grab the shaft and yank. This either broke the arrow off inside you or ripped the barbed arrowhead back through all your organs. The arrow spoon was actually an upgrade, which tells you everything about ancient battlefield medicine. The surgeon slides this metal spoon down the arrow shaft, cups the barbed arrowhead, and then very slowly extracts the whole thing while you experience what Roman soldiers called the second wound. One account describes this taking over an hour because the surgeon had to work around 3 barbs lodged between ribs. You've complained about getting blood drawn. This guy had someone mining for arrowheads in his chest cavity like they're prospecting for gold. Point number 6, the tonsil guillotine. Let's talk about the 1800s when doctors looked at your throat and thought, you know what this needs? A guillotine, a tiny one. Just for tonsils. You walk in with a sore throat expecting cough syrup. Instead, the doctor pulls out a miniature execution device and asks you to open wide. No anesthesia, no numbing. Just Victorian determination and a spring-loaded blade aimed at the back of your throat. Here's the logic. Cutting tonsils with a scalpel takes agonizing minutes. But if you loop a ring blade around them and just snipe, the whole ordeal is over in 30 seconds. Shorter screaming equals better medicine. That's science. One medical journal from 1842 documents a physician who removed 200 uvulas in a single year. 200 people walked in with minor throat complaints and walked out missing body parts. The journal notes most patients tolerated the procedure with minimal struggling, which is Victorian speak for some people fought like their life depended on it. They used these until the 1970s. Your grandparents might be tougher than you think. Point number 5, the lithotomy scoop. Kidney stones are already nature's cruelest joke. Modern medicine uses sound waves and medication. But in 1750, they sent in a medieval melon baller through your urethra. Here's the nightmare. They didn't open you up first. This metal mining equipment traveled through parts of your anatomy that should never experience metal equipment. You were awake, conscious, aware of every millimeter. The procedure was called cutting for stone, and the fastest surgeons finished in under 3 minutes because any longer and you'd die from shock. Imagine someone rooting around inside your bladder with a scoop, feeling blindly for a stone, trying not to puncture anything important. French surgeon Frère Jacques performed over 4,000 of these. He claimed a 90% survival rate, but that 10%, 400 people, died screaming in ways that traumatized witnesses for life. Every time you've dreaded a catheter, remember, people voluntarily endured bladder excavation with antique silverware. Point number 4, the mouth gag and tongue iron. You hate the dentist because they put a mirror in your mouth for 30 seconds. Now let me tell you about the mouth gag, a car jack for your face. This iron contraption with a screw mechanism cranks your jaw open and locks it there. You can't close it, can't swallow, definitely can't scream properly. Then they add the tongue depressor, a tiny medieval anchor that pins your tongue down. This wasn't even for dental work. They used it for throat surgeries and removing uvulas for basically any reason doctors could invent. The surgeon turns a screw that forces your jaws apart until your temporomandibular joint screams for mercy. One 1780s surgical demonstration describes a patient whose jaw dislocated mid-procedure, and the surgeon just kept working because the operation was nearly complete anyway. The patient's jaw, dislocated. And the doctor's response was, well, we're already here. They stopped using these when anesthesia became common and patients stopped fighting back. Turns out unconscious people don't need medieval restraint devices. Point number 3, the osteotomy bone chisel. Ancient surgeons looked at broken bones and thought, you know what this needs? A chisel and a mallet. Let's do carpentry, but the wood is alive and screaming. The osteotome is exactly what it sounds like. A surgical chisel for carving living bone. It comes with a matching mallet. These look identical to wood chisels in your grandfather's garage because they basically are. This wasn't crude hacking. It was precise work. Surgeons carefully split bones, removed diseased sections, reshaped joints. Except the marble was awake, tied to a table, and reporting every tap to its brain in high-definition agony. During the Civil War, soldiers reported that bone chiseling hurt worse than the actual amputation saw. Worse than having their leg cut off. One Confederate soldier's diary, the surgeon tapped that chisel 12 times. I counted. I still hear it. Modern orthopedic surgeons still use osteotomes. We just got better at making sure you're unconscious during the carpentry session. Point number 2, the uvulotomy. Doctors in the 1800s looked at uvulas and saw nothing but opportunities. They couldn't agree on what the uvula did, but they were certain removing it cured everything from snoring to stuttering to respiratory infections. Spoiler, it didn't. They just really enjoyed cutting it off. The uvulotome is a specialized guillotine for your uvula. Ring blade, spring-loaded handle, one motion. The whole procedure took 10 seconds. You come in for snoring. The doctor grabs your uvula with forceps, you're gagging, he slips the blade around it. Snipe. Your uvula's in a pan. You're choking on blood. One physician removed 200 uvulas in a single year. That's almost 4 a week. He saw every sore throat as a personal challenge. Doctors would perform this on patients who came in for unrelated issues. Oh, you're here for a cough. Let me just remove this uvula. No? Too late. They stopped when doctors realized the uvula actually helps with speech and swallowing. Only took 80 years and several thousand unnecessary mutilations. Point number 1. The amputation kit. Let's end with the king of surgical horror, the amputation kit. Beautiful wooden box lined with velvet. Because violence deserves elegant packaging. Filled with knives, a bone saw with shark teeth, and a tourniquet. You're a Civil War soldier. Shattered leg. The surgeon approaches with his lovely box, and you realize your leg's relationship with your body is about to become past tense. Here's what destroys faith in medicine. The fastest surgeons were considered the best. Robert Liston could amputate a leg in under 2.5 minutes. He was celebrated. He had fans. People watched like it was a sporting event. Speed meant less screaming, but also mistakes at saw blade velocity. Liston once accidentally amputated a patient's testicles along with his leg. Another time, he cut off his assistant's fingers during a vigorous amputation. Both the patient and assistant died of infection. That surgery has a 300% mortality rate. The procedure: tourniquet cranked tight, circular incision through muscle to bone, peel the tissue back like opening a traumatic banana, then saw through bone while bone dust mixes with blood. One soldier's letter, they sawed his bone in 40 strokes. The whole affair took 4 minutes. He died that night. I envied him the escape. Death was the preferable outcome. The sound of saw on bone could be heard through closed doors. Witnesses called it the worst sound a human can make. You've called a stubbed toe a serious injury. These soldiers had limbs sawed off while conscious, then faced 50% odds of dying from infection anyway. Modern surgical kits use the same tools. We just added anesthesia so patients can't describe the experience. Progress is making sure there are no witnesses who can talk. Thanks for watching. If you enjoyed this, don't forget to hit like and subscribe. See you in the next one.